People with autism have an indisputable right to live independently, for self-advocacy and involvement as far as possible in decisions affecting their future, accessible and appropriate education, housing assistance, care and support services, as well as sufficient income, freedom from fear, threat, and from abusive treatment. We, as persons with autism advocating for ourselves and parents advocating for our children with autism, with the contribution of professionals who share our views, pledge ourselves to press for these rights to be enhanced and enforced by appropriate legislation worldwide. And that is what the World Autism Organization is mostly busy with nowadays when we have meetings or when we have little online conferences, is to inform people about autism and how to start up autism services within their countries or regions. There's very much work to do, and we're finding that all over the world, parents mostly have the same difficulties and the same issues. So there's a lack of access, there's a lack of assessment because there are long waiting lists. So on the other hand, as autism has from the time when our Michael was born, when it was considered to be 4 to 15 people in 10,000, it is now considered in some countries 1 in 56, elsewhere it's 1 in 68 or 1 in 100. And that probably has to do with people knowing more about it, and also many adult autistics coming to the fore, now finding out that they're actually on the spectrum. So to assist all those people, we have a huge network of our volunteer members on the Council of Administration that assist where we can. Every 4-year Congress gets held. 2022, we did not have a Congress because of COVID. That sort of came in between. The next Congress will be in 2026, and we will be hearing soon as to where that will take place. It will probably be a hybrid Congress, and I hope all of you will sign up to the World Autism website, and also to ARI, because like Dr. Stephen Edelson has said, there are regular webinars which are also hosted together with the Autism Organization. And the Autism Organization has a small YouTube channel which we'll populate as well with videos to assist parents and others how to work with different aspects of autism. Thank you very much.
Okay, thank you, Petra. Paul?
Yes, hello, I'm Paul Shattuck. I'm the parent of a young man who's 54 now. He was one from a long time ago, and at the time we were struggling looking after him. Quite honestly, the knowledge in England wasn't very good. It wasn't very useful. And I looked in the books and I found this outfit in California, and I was told they were rebels and all this sort of thing. So I phoned them and I spoke to Bernard Rimland, and it was the first time I'd heard real sense about how I could help my son, things to do and so on. So I've been a fan and a sort of member of it ever since. Unfortunately, Bernie died in 1906, I think it was, something like that anyway. And his young assistant had to take over. And we thought it wouldn't do too well. But in fact, he's a very daring young man. And he did brilliantly. I'm very proud to be able to introduce him to you. His name was Stephen Edelson. And there he is in front of you. He's still wearing the same shirt as he was wearing back in the 20th century anyway. But I want to profess I'm jealous I'm thankful for all the work that Steve has been putting in over these years. Not only has he kept it going, but he's introduced a lot of new things which the Autism Research Institute now does, raising money for researchers, a sort of museum of things. And one of the things that Steve does do very well is remember things. I don't remember many names, and I have to keep asking, who was that one who did this, that, and the other? And so I'm hoping he's writing a book. I'm hoping they'll all be in there for us so that we can use them. But anyway, you didn't come here to hear me gibbering on, so I'll hand you over straight away to our speaker, Stephen Edelson.
Thanks, Paul. Actually, Paul and I try to talk once a week, usually Friday mornings my time, Friday early evening his time, and we reminisce of the past and talk about the future. And occasionally, when I have a new idea, I ask Paul for his advice and suggestions. And yeah, it's worked out quite well. And we've known each other. We talked the other day about 30 years, so we've seen each other grow up together. Yeah, but thanks, Paul. Yeah. So actually, I've been involved in the autism field for over 45 years, and I was an eyewitness to many of the milestones during this period of time. Early on, I began studying under Ivar Lovaas at UCLA. I was 19 years old then, and I was the only undergraduate working directly under him. And then many of my ideas were more biological, physiological. And he then introduced me to Bernard Rimland, and I drove down to San Diego and we hit it off. And I worked closely with him for roughly 30 years. Also interesting, I've also known Temple Grandin since the early 1980s, where we first met while we were both graduate students at the University of Illinois. So about once, maybe twice a month, we'd get together for lunch or dinner and share our notes of what was going on in the autism field, because I think we were the only two people in the entire campus of probably over 40,000 who had a keen interest in autism. So actually, before we delve into the 100-year history in less than an hour, I'd first like to get things started by showing you a video on ARI's relatively new National History of Autism museum located in San Diego.
The National Autism History Museum offers an in-depth journey through the history of autism, tracing its roots back nearly 100 years. The museum presents a thorough timeline, often overlooked achievements, and authentic historical items that narrate the saga of autism. Dr. Steve Edelson, a respected figure in the autism community with a career spanning over 4 decades, has carefully curated the exhibits, drawing inspiration from distinguished colleagues such as Drs. Temple Grandin, Bernard Rimland, Margaret Bowman, and Ivar Lovaas. The museum's narrative is a chronological account, starting with the first documented study of autistic behaviors observed in children made by a Ukrainian researcher in Russia in 1925, extending to the Netherlands in the 1930s, and finally to the United States in the 1940s. Timed with the 80th commemoration of Dr. Kanner's pivotal 1943 work, it is set to mark the centennial of the first scholarly article on autism in a couple of years. Dr. Leo Kanner, widely recognized as the father of child psychiatry, published a detailed description of autism in 1943. His landmark writings on the topic have been compiled into a rare anthology, which, along with its scarce book cover, is on display for public viewing at the museum. Nearly 2 decades later, Dr. Bernard Rimland reshaped the autism field by emphasizing its biological origins, challenging the then widely held belief that autism resulted from parental neglect or emotional distress. His impactful work is showcased in the museum through a rare UK edition of his influential book, Infantile Autism: The Syndrome and Its Implications for a Neural Theory of Behavior. The museum emphasizes crucial events, including the American Psychiatric Association's evolving definitions of autism and the documented prevalence from 1966 to 2023. Pioneering scientific advancements in genetics and neurology are also highlighted. The museum honors Temple Grandin, an iconic figure in the autism community, by featuring a galley proof of her most famous book, Thinking in Pictures. The museum also explores autism's portrayal in cinema, with notable attention to Rain Man, a film where the Autism Research Institute played an instrumental role in its production. The introduction of Julia, a Muppet used to increase awareness of autism on Sesame Street, is also spotlighted. A thought-provoking exhibit presents an assortment of logos used to represent autism since the 1960s. Originally, autism was represented by one or more puzzle pieces. The first puzzle piece logo was created to depict a child engaged in finger flicking, a common autistic behavior, but frequently misinterpreted as a crying child. Following the expression of dissatisfaction from autistic individuals who felt the puzzle piece suggested they were lacking a vital human aspect, prominent national autism organizations in the United States and the UK modified their logos to better represent autism. The museum also shines a light on savant abilities, which are observed in about 10% of the autistic population. These include skills like calendar memory, where an individual can determine the day of the week based on a given birth date. Visitors can watch 2 videos featuring Dr. Rimland's son, Mark, who has this ability and demonstrates how he performs these calculations. Among the displayed artifacts is a 1964 Life magazine issue discussing electric shock as a treatment approach at a renowned UCLA clinic. Also available for view are foundational scientific texts on autism, many of which were originally delivered as papers at think tank meetings. Guests can also thumb through a book written by a sociologist who presented a persuasive argument that President Thomas Jefferson had a form of autism called Asperger's syndrome. The museum plans to continually introduce more interactive materials for its visitors. Enhancing the experience, mobile accessible audio guides and videos delve deeper into the exhibits. Additionally, the museum features art by autistic artists. The aim of the museum is to foster understanding and awareness of autism, acknowledging its considerable influence on many individuals and their families. Through an extensive depiction of autism's evolution, the museum seeks to promote acceptance and improve societal support for those on the autism spectrum.
Okay, well, if next time you're in San Diego, please stop by, see the museum. I should mention that we are also having smaller displays for libraries and hopefully at airports. We pilot tested several displays in San Diego, and we hope to go national later this year, next year, and to coordinate autism history displays through eventually throughout the world. So we'll see how that goes. Fingers crossed. Okay, so with this talk, I titled A Century of Discovery and Development, given this is the 100th anniversary of the very first writings on autism. And this was by Grunya Sukhareva. And she actually wrote 2 papers, one in 1925, one in 1926. And basically, she was a child psychiatrist born in Ukraine and worked in Russia. And in her writing, she describes 6 children and used the term schizoid psychopathy. And if you read the writings, actually, what she's describing is very similar to Asperger's syndrome. And then it wasn't really until the 1940s where it was the first, you might say, documented popular description of autism. And this is by Leo Kanner. And he was a clinical researcher at Johns Hopkins University in Baltimore. And I think one of the reasons why his paper became so popular that he was a well-established child psychiatrist. In fact, he is credited with writing the first textbook on child psychiatry, and many people consider him the founder of child psychiatry. And in his article, he described 11 cases in great detail. And still today, the autism community considers his writings quite accurate. It's probably still one of the most cited papers on autism. And what's interesting, the first case he described he labeled a case 1 Donald T, and later it came out that his name was Donald Triplet. And basically, he died just a couple years ago in 2023 at age 89. In fact, there was a PBS documentary on the history of autism. They didn't go in as much detail on the history, but just major milestones. And in it, they did highlight Donald. They interviewed him and his friends in his community. And it was, I believe the title was In a Different Key, similar to the book on the history of autism, which was nominated at one time for a Pulitzer in nonfiction. And with Connor, his description was so you might say accurate that for a while people would refer to autism as Kanner syndrome, and then eventually classical autism. And then the next year, a professor at the University of Vienna, Hans Asperger, he was an Australian pediatrician, and he described 4 cases. And it really didn't receive much attention when it was first published. And it wasn't until 1981 when one of the eminent professors in autism, Lorna Wing from the UK, published a paper in 1981 where she highlighted Asperger's paper. And right now, Asperger syndrome is part of, you might say, our culture. People have a pretty good idea of what it means. However, over 10 years ago, the American Psychiatric Association, in their Diagnostic and Statistical Manual, they actually removed Asperger syndrome as a diagnosis. And I hope someday they'll reconsider and maybe possibly put Asperger syndrome back into it as either a subtype of autism or a separate category. In fact, a couple of years ago, I published a paper arguing with some data that Asperger syndrome is a subtype of autism, and you could just Google it, maybe Edelson and Asperger syndrome, and hopefully something will pop up. And then in the 50s, we have Bruno Bettelheim. Actually, it was in the late 50s. He published his first paper on autism. It was in the magazine called Scientific American, and the title was Joey the Mechanical Boy. And in it, he argued that parents were to blame for autism, that they were emotionally neglecting their children. And at that time, it became very popular theory of why autism was occurring in some individuals. And at that time, the intervention was having parents go to marriage counseling, and that children would receive play therapy. So that was, you might say, the treatment of choice, even though there was no evidence to support this emotional neglect of children. And then it wasn't until the 1960s, and we mentioned Bernard Rimland several times already, and he came up with a book in 1964 called Infantile Autism, and he argued that autism is a biological condition. He didn't have any brand new data to share, but his argument was so persuasive, it really convinced people worldwide to refocus their attention and consider autism, as it says, as a biological condition. So it really turned the field topsy-turvy. And in his book, he actually pointed 3 areas that he thought were connected to autism. He pointed to genetics. So he actually was the first one to suggest genetics. He also thought neurology plays a part, and he theorized that an area, it's the center of the brainstem called the reticular formation, might be involved, and that's actually involved in arousal. And there's mixed findings, but there is some evidence. So probably some subtypes might have some differences in their brains stem, particularly the reticular formation. But he also suggested the environment had an impact back in the 1960s, which today we feel that probably most cases of autism are epigenetic. It involves genetic susceptibility and environmental exposure. And then although Rimland worked full-time for the Navy as a civilian in the personnel department, in the evenings and weekends, he'd work on autism. and he established the Autism Research Institute in 1967, primarily to encourage researchers to start looking into autism as far as trying to understand the condition and how best to help these individuals. So he would write to psychology and medical departments at all major universities and sending them information about autism and encouraging them to do research. But he also realized that one way to get inside the university was to co-produce a documentary that could be shown to students called The Invisible Wall. So it came out in '68, and in it, here's a still of Rimland, and where he shares his insights and theories. They also included interviews with several parents. One of them was Ruth Sullivan, and she later worked with Rimland to establish the Autism Society of America, which I'll be talking about a little later. And I should mention this documentary was my first exposure to autism. I took a child development class, I think it was my first year at UCLA, and saw the video, and I just remembered the video. I didn't at that time say, well, I might be interested in being involved in this field of study, but I know it really made an impression on me, and I assume it made impression on other people. And again, the goal was to have people within universities discussing autism, maybe future students in the future, they would dedicate their lives to autism and understanding it, as well as he felt that some of the researchers may be watching it as well. So that was his primary goal of this documentary. And again, you can watch it on YouTube. We uploaded a while ago. And if you are interested in the history of autism, it's worth about 20 minutes of your time to watch it. Also in the 1960s, and I'm not sure the exact dates, but I believe it probably was inspired by Rimland's '64 book, saying it's a biological condition. At UCLA, at the Neuropsychiatric Institute, Edward Ritvo and his colleagues started studying medical aspects of autism, and they published quite a bit. Ritvo passed away just a few years ago, and I remember communicating with him after he was ill, and we were trying to set up a time to get together, but unfortunately he passed away. But they often, at UCLA, among other things, they focused a lot on relatively powerful medications like Haldol, Melril, and Tegretol. And the Neuropsychiatric Institute is still going strong today at UCLA, looking at many different aspects of autism. And actually, Catherine Lord, one of the top people in the field, is there now. Also in the '60s, Ivar Lovaas, he started to pioneer behavior therapy. And basically, he wasn't the first one to try behavior therapy. It was a Carl Ferster, F-E-R-S-T-E-R. He published papers in the early '60s. And in fact, last December, I was hosting a think tank at Columbia University. And one of the participants afterward, he came up to me and says, you know, he actually studied under Carl Ferster, and you could imagine I had a lot of questions to learn as much as I could about this true pioneer. And so with Lovaas, he initially started studying challenging behaviors. Much of it was on self-injurious behavior and repetitive behavior. And regarding self-injurious behavior, somehow I got interested in it while studying under Lovaas, and we worked together and published a big study on that. But eventually, Lovaas expanded his efforts to include other aspects, including communication, education, and also social interaction. And Ruth Sullivan, I mentioned earlier, with help with Dr. Rimland, she helped establish the National Society for Autistic Children, which was later changed to the Autism Society of America, and also was changed to Autism Society, and I guess they go back and forth on using that. But yeah, this year is the 60th anniversary of the Autism Society. And basically their initial goal was to inform parents on ways to help children with, as it says, communication and behavior therapy. And just briefly, what happened, Dr. Rimland, he spent a year at a think tank associated with Stanford University. And during that time, he felt there should be some parent network group where parents could share what is helping their children and what's not. And they could also share resources in the area, like dentists, doctors, and so on. And and as well as set up telephone trees, parent support group meetings, and so on. So he wrote to all the parents who had contacted him, who had showed interest in becoming actively involved in the autism community. And one of the ones who responded to his request was Ruth Sullivan, and they got on quite well, as you can imagine. And Ruth organized the very first meeting, and during that meeting, they felt that they, yes, should follow Rimland's advice and really develop a national support group for parents. And also in the 1960s, so this is all pioneering work, getting off the ground, going beyond the Bettelheim thinking. Eleanor Mildred Creek, she organized what's called the British Working Group, which consists mostly of experienced professionals in the UK. And based on both their experience as well as Kanner's writing, they developed a 9-point criteria to diagnose autism. So this, one could say, was the first official diagnostic criteria for autism created by professionals. A year later, in '62, Helen Allison, she helped establish the National Society for Autistic Children, so predating the Autism Society of America by a few years. And NSAC is actually still very popular. They publish a journal, and they're very active today. And so I commend them for all the years that they've been working. And then even a year later in '63, Neil O'Connor, I think it's Betta Hermelin, they actually started studying, which is not as, which should be more popular, including these days. We started focusing on cognition, specifically attention and sensory processing. And I do feel that's a very important area of study, which has not received as much attention as it should receive. Also in the '60s, Victor Lauder, he actually conducted the first prevalence survey on autism, and where he actually examined every 8 to 10-year-old child in Middlesex County, which is a little south of London. And basically, from the statistics, he concluded autism is 4.5 out of 10,000, so roughly 1 in 2,000. And basically, that stat was referred to for many years until the 2000s, and when they, especially the CDC, started focusing more attention and money in terms of coming up with a better estimate of the prevalence rate of autism. Also UK, Uta Frith, I believe she's still alive today. She published a lot, and she developed the central coherence theory of autism, which received a lot of attention. And basically, she argued that autistic individuals often have difficulty integrating information and into a coherent whole. And since they have difficulty, instead they focus on details or parts rather than the broader context or the big picture. And then Lorna Wing, who I'd mentioned regarding Asperger's syndrome, she was one of the top eminent researchers in the field, psychiatrist. She wrote, her first book was published in '64, so same year as Rimland's book. And what she came up with, what she called the triad of impairments. So instead of the 9 points that the British Working Group came up, was she brought it down to three major ones, and that was social interaction, communication, and repetitive behaviors. And actually that had an influence later on in the DSM when they focused more on those 3 areas. So now we can move to the 1970s, which is still quite a while ago. And I got actually involved in the late 70s. As far as genetics, I had mentioned Rimland was the first one to suggest there's a genetic component to autism, but Susan Folstein and Michael Rutter actually published research data where they looked at identical twins and fraternal twins, where fraternal twins, it's kind of like brother, sister, they overlap about 50% in genetics, while identical is, I believe, 100% overlap. And they found that autism is much more prevalent in identical twins than fraternal twins, and basically concluded that there was a genetic component to autism. And this is actually a very well-cited study on genetics and autism. Also in the 70s, sensor integration started to get some attention by a woman named Jean Earsh. She pioneered this work at the University of Southern California, so in Los Angeles. So back in the 70s, you had a powerhouse actually in the Los Angeles area, where at the Neuropsychiatric Institute, you had Ed Ritvo and his colleagues, you had Ivar Lovaas also at UCLA Psychology Department, and Jean Earsh across the city looking at sensory integration. Also in the 70s, nutritional health became an issue, and Rimland published some of the early work on nutritional supplements, especially vitamin B6 and magnesium. And some recent research indicates that there's a subgroup that do benefit from B6. And basically what happened, Rimland started receiving letters from parents all over the world, literally saying they tried certain vitamins and their child got better. And initially, he didn't believe it. He said, how could a vitamin help an individual who has a lot of severe behaviors? And so he first just ignored it. But then he realized that these parents probably were not in cahoots with each other and say, let's go full Rimland. And he said, well, maybe there is something to it. So he pulled out all the letters, and he tallied what vitamins they were suggesting. And he came with a list of about, I think, 4 or 5 different ones. And so he decided to do a study where he mailed families all over the country one of those vitamins or a placebo, and they didn't know what was in it, as well as some behavior ratings. And when they came back and he tallied, vitamin B6 was definitely considered more effective than the other ones. And basically with B6, it reduces magnesium in your body, so that's why you often include magnesium when giving B6. So in the 1980s, the Diagnostic and Statistical Manual came out. Well, actually in 68, it was in their second edition. That was the first reference to autism, where they actually stated some children exhibited, quote, autistic, atypical, and withdrawn behavior. But at this time, this was part of the diagnostic criteria for childhood schizophrenia. And actually, there was quite a bit of debate at that time whether childhood schizophrenia was a subtype, or autism was a subtype of childhood schizophrenia, or they were totally different. In fact, the first journal on autism was titled The Journal of Autism and Childhood Schizophrenia, which the editor was Leo Connor, at least for the first year. And then given a lot of the discussion and debate in the 70s, when the DSM-3 came out in 1980, autism had a separate category called infantile autism. And basically, it was very similar to Lorna Wing's triad of impairments, where a lack of responsiveness to other people, language issues, and unusual responses to the environment, like insistence on sameness or attachment to objects. And they also put in there the onset would be before 30 months. And then 7 years later, a revised version came out, and basically they gave a broader definition of autism, so there's more of a spectrum around a specific condition. So let's continue in the 80s. So you have Margaret Bauman and Thomas Kemper, And basically they documented the first, they have the first evidence of neurological differences in a 29-year-old man. Basically, Rimland suggested something neurological is involved, but it wasn't until this study where they actually showed definite changes compared to a control. And I remember this received a lot of international attention, big story in the Boston Globe. And what happened just recently when I was in Boston in December, Dr. Bauman actually donated all the tissue slides from that study to the museum. The other day I did I ordered the slides from the front going to the back, and I have a little video where I slowly show them. And so this is from the very front slice and then going back. So these are the actual slides from the very first study on brain tissue in autism. Yeah, so what Margaret told me that after work, being a clinician every day, she would then go to the laboratory and use her microscope and actually count the little neurons for the study. Yeah, I wanted to show that they're I'm looking for some light box to put the slides on, and also a portable microscope. And I hope within a couple months, hopefully before the summer, I'll have it so that visitors at the museum could actually look at these slides, the original slides. Okay, also in the 80s, basically Ivar Lovaas, he published a detailed manual for teaching. And it was often referred to as the Me book. And basically, Lovaas and his colleagues wrote the book so parents or even professionals could go through it and know exactly what to do and how to do it. And I know they spent several years. And when I worked under Lovaas for 3 years, I remember reviewing it and giving a little feedback. But just a quick little story. I don't think many people know this. So it was a clinical meeting at the UCLA Lovaas Clinic, and we'd often discuss the Me book and what to put in it and so on. And one of the graduate students, he said, Ivar, how did you come up with the idea for the Me book? And Lovaas said, well, a lot of these individuals are, self-absorbed. They only think about themselves and so on. And then the graduate student had a big smile and said, well, we actually have the book called the Me book in our clinical library for children. And and so this is, and then Lovaas said, well, there's more to the title than the Me book and so on. But again, that's a little trivia that not many people know about. Also, during that time, Lovaas published a study on the long-term effects of behavior therapy, where he concluded that nearly half had recovered. And he has his own definition of what recovery would be. And this actually, I remember seeing on national news. I believe it was on CBS. And I videotaped it at one of the early video machines, but I still haven't been able to find it. But hopefully someday I'll find that news story. Also in the 80s, Temple Grandin came up with their first book, was in 86, and called Emergence, Labeled Autistic. She actually asked Rimland to edit it for her, and he wrote the introduction. And if you saw the HBO movie Temple Grandin, it was based on this book. And then also Thinking in Pictures, that was her bestseller, I believe, and Visual Thinking, her most current one. And this is a picture of me and Temple taken last year. And this I've known Temple since we were both graduate students, and we've co-published studies together. And for some of my books, for some of my books, she has written the foreword to them. And then also in the 80s was the movie Rain Man. And I think most people know about that, but they don't know the story, how Yeah, I guess someone wants to talk to me. But basically, what happened, the producer of Rain Man contacted Rimland and asked him to look over the script, because Rimland had published quite a bit on savant abilities. And at that time, Raymond was intellectually challenged. And so Rimland read the script and thought it was very good, had some suggestions. And then Rimland called me up and said, well, I'm about to write up my suggestions for this new movie coming out. He said, I'm thinking of maybe, mentioning that it might be more interesting if Raymond was autistic. And because they have a lot of savant abilities. And I said, well, yeah, doesn't hurt to suggest it. And I said, well, I would, give a really good case why, it would be much more interesting. And so Rimland did write to the producer, and, history was made, and autism received a lot of attention since. And Rimland was actually given credit for head consultant. And when they sold the VHS tapes, there was a fairly large contribution to the Institute for his contribution. So moving to the 90s, basically there was major groups that were established because it appeared that autism becoming more prevalent and there needed some help in one way. So ARI actually established the Defeat Autism Now program, which involved a lot of different aspects, but the main focus is on medical conditions. And there was much discussion on immune and gastrointestinal systems. And actually that, I think, brought those two medical areas into the limelight, because there was some discussion before, but not much, but there's a lot of attention there. And maybe someday we could just have a whole talk on Defeat Autism Now, because there's a quite interesting time. Also, we have Cure Autism Now, came up around the same time, because Portia Iverson, who actually helped with the initial Defeat Autism Now, she wanted things to move a little faster and in one way or another, so she came up with Cure Autism Now, and also was interested in the biology of autism, and they focused on biological interventions, prevention, and also hoping for a cure for autism. And basically, 10 years later, they merged with Autism Speaks, which is currently one of the largest autism organizations, where there's a focus on autism and awareness and support. Okay, so in the 90s, some other groups established on behavior therapy, Families for Early Autism Treatment. Basically, they were inspired by Lovaas's work in the Me book, as well as a book about an autistic child who did extremely well from the Lovaas Clinic called Let Me Hear Your Voice, that received a lot of national attention. And basically, the families throughout the country are saying, we want behavior therapy for our children. So Families for Early Autism Treatment was established. They worked closely with government officials, insurance companies, public schools so that they'd offer behavior therapy. Also, the first, I think, major e-newsletter on the internet on autism was the Families for Early Intervention, or FEAT newsletter. And this was overseen by Lenny Schaefer, who's a good friend of mine. And also, he was very close friends with Bernard Rimland. In fact, I think they talked every night about different issues. And I believe Lenny Schaefer and this FEAT newsletter should be credited with one of the first, if not the first, e-newsletter on the internet. Also, what was happening, given the popularity of ABA, and given there was now several manuals on teaching ABA, that there was people who either were just undergraduates working under Lovaas who did some ABA with 1 or 2 children, as well as some other people who just read the books and opened up their own clinic offering ABA with little experience and understanding. And as a result, several professionals got together and said, well, we need to come up with some certification. So the Behavior Analysis Certification Board, they worked very hard so that now they can certify people in offering ABA. And so the 2000s to today, that's 25 years, but we could go on forever if I break everything down. So a lot of emphasis still on genetics, DNA, exome sequencing, epigenetics, which I briefly mentioned earlier, where a lot of strong evidence connecting genetic susceptibility to toxins or pollution in the environment. For example, the closer one lives to a highway, the risk of autism increases substantially. The closer one lives to a field or farm that uses certain pesticides or organophosphate pesticides, the increased likelihood of autism. I remember even reading a study, or maybe been at a conference, where the closer one lives to a hazardous waste dump increases the risk of autism. So the environment is starting to receive a lot more attention as instrumental in autism, and we really need to start, looking at this in more detail. I know that there's something called the P2I program, where they're just getting off the ground, where they're working very hard to instruct healthcare providers in terms of how to give advice to mothers during preconception or pregnancy to eat clean food and breathe clean air and so on. And I'm somewhat involved in that. Also, attention into neurology, brain tissue research, brainwave imaging, looking at specific neurotransmitters, medical conditions, gastrointestinal, immune, metabolism. I could also include anxiety, depression, sleep disturbances, and more. And behavioral, the early start Denver models received a lot of attention. Functional communication, Ted Carr and Mark Duran's work, I think that has really made a huge difference, where a lot of behaviors are due to communication, and you just teach them better ways to communicate. And also pivotal response out of Laura Schreiman and Bob Cagle and others, I think should receive a lot more attention than it has, because it makes, at least for me, a lot of sense. And then finally, adults and seniors. We kind of jumped into the adult autism field a little later than we should. I know with Ruth Sullivan, for many years, she was saying we've got to focus not just on children, but on adults. And it took a while, I think, especially the last decade, maybe 2 decades, there's been a lot more attention to adults, dealing with housing, employment, also recreation. I think there should actually be more attention to that, as well as medical issues. We're learning that a lot of the medical issues that started when they were children still are through teenage and adult years, especially GI issues, anxiety, immune, and so on. And also, just more recently, I've been working with a group looking at senior issues, basically those 50 and older. And we had a couple of major think tanks. The first major think tank we put together, we published a description of the issues in the Journal of Autism and Developmental Disorders just a couple of years ago. And we had one this last November, and we're about to publish that fairly soon. And I think there's going to be a lot more attention on senior issues, because what happens when they become elderly and they need to be in a nursing home? Will the nursing staff be aware of autism and be better able to help them? Or even not just that, as far as group homes, will there be group homes for seniors, and will they be able to, understand, their behaviors and sensory sensitivities, anxiety, and so on. So I do see much more attention on adults and seniors in the not too distant future. Okay, well, I covered quite a bit. I'll try to cover 100 years. Obviously, there's a lot more, and if there's someone else giving a history talk, they'll probably highlight different aspects and different areas than I have. But basically, I spent a lot of time thinking of different things, and this is what I feel is important to understand how autism has progressed over the years. So thank you. Yeah.
We do have a few questions for you, if we've got a little bit of time for those. We've actually got a few people. Well, first of all, people are very interested in the museum, so hopefully we'll have a few visitors coming up here soon. And we have a few questions about Asperger's syndrome, and kind of how that term has been removed from usage and how that compares to speaking in levels of autism, as in levels 1, 2, and 3, and kind of your perspective on the ethical implications of using that term.
Right. Well, as I said earlier, I would like us to reevaluate Asperger's syndrome because, one, it's part of our culture. A lot of people use the term still today. Yet I'm not, you're really not supposed to use that term in a formal setting. And really, there shouldn't be research studies that Asperger's syndrome because it's not supposedly a diagnosis. Basically, when they removed it from the DSM, there was actually a quote that was published in the New York Times by the person who was head of the committee on the diagnosis of autism. And he basically said they primarily did it because of funding and money. Not that they're paid off, but rather the cost of helping people with, quote, a milder form. But yeah, there was some monetary decisions made with regarding removing Asperger's syndrome. And honestly, it would be nice to, have quite a few people in the autism community work together to bring that diagnostic category back. Because when you're trying to understand autism, we know that there are different types of autism. Some the research says 3 types, some says 12 types, some of our data says 14 types, some say 200 types. And in order to understand autism, as well as what is effective for each type, because nothing helps everyone, you really need to break down the spectrum to understand the different types. But by removing PDD and Asperger, they're kind of moved in the opposite direction. And so that's just going to make it more difficult for us to figure out, how best to help these individuals.
Awesome, thank you. There was another question about if you think it's advisable to separate these types, which I feel you kind of answered in that discussion.
Well, it's my opinion. I know other people have different opinions, and if you have different opinions, it'd be best if you could work it out and negotiate. And sometimes that works, and sometimes it doesn't.
So another question on terminology, talking about. And a lot of people in the autistic community talk about autism not being a disorder. And that, again, differs between people. But what are your thoughts on removing the word disorder from the label?
I'm quite fine with it. I'm not sure if I said that during my talk, but I actually refer to it more as a condition. But I do feel we need a label, because by having labels for different conditions, then you have a better understanding, and I think have a much better idea of how to help an individual given a certain label. But I know others will say labels are for cans and not for kids. And so, yeah, this is an opinion, and opinions are not facts, and this is just, how I view it at this time.
So we have one comment about a movie. So this is from an autistic father who likes the movie I Am Sam. I just wanted to make sure that we might consider that, putting it into the museum.
Actually, it is in the museum.
Okay.
It was one of those descriptions, and actually it was just not too long ago. I'm surprised this came up, but I've been going through boxes because we have a lot of boxes, and I actually found a sealed VHS tape of I Am Sam. Yeah.
That's a
Just by
throwback.
yeah, no, but no, it's an excellent movie. Well, also regarding movies, a lot of people don't know that Elvis Presley was in a movie back in '69 titled A Change of Habit. And it was Elvis, who was a medical doctor, who falls in love with Mary Tyler Moore, who is studying to be a nun. And so she had a conflict of joining the nunnery or being with Elvis. And Elvis would cure autistic children by holding them really tight. And actually, although that sounds a bit odd, for a while there's something called holding therapy, which received a lot of attention. There's a book, Martha Welsh wrote it, and where she argued just holding them tightly, and it just might help with the bonding. But it's very controversial. But yeah, so it's 1969. Yeah, Elvis and Mary Tyler Moore.
So we have about 2 or 3 more questions here. One, we have a few people wondering what was to be learned from those brain slides that Dr. Bauman published.
Right. Well, she was the first one to show there's specific areas, especially in the cerebellum, but a few others where they have fewer neural cells. So that was it, fewer neurons. And again, there was never evidence prior to that as far as any brain structure issues. Yeah, and also if you go to the museum and see these slides, the father, well, it was a 29-year-old man who passed away, but the father, when the individual was much younger, probably in his 10, 12 years old, painted an oil painting of his son looking downward. And actually, Dr. Bauman had the original, and she donated to the library. So besides seeing, the slides, we also have a portrait in honor of this individual.
Okay, we've got one more here. We have one attendee who's interested in hypotonia and autism, and wonders what research there is going on. I know ARI has a few webinars on that. So if you guys look at the
I would suggest doing the webinars. Personally, I haven't studied it, and I try not to comment on issues that I really haven't, studied myself. But it's common in autism, but I think watching the webinar and hear it directly from an expert is the best thing to do.
So now we just have a few comments here. Very grateful for the work that you're doing and continuing this research. And then very last one, I think this is a good one to end on. What professions do you think need to have coursework or an understanding of what autism is built into their requirements?
Well, I don't know.
For example, in university settings, I guess.
Yeah, I'm not sure. I know there's a big push by Margaret Bauman and quite a few others that medical students should take courses in autism, given the prevalence is quite high. And I know at ARI occasionally we think of maybe sponsoring grand rounds or doing something. We haven't figured out exactly what. But I know I hear every year more and more that medical students should take a course on autism. Because honestly, I think I remember hearing from Lovaas is if you know how to help an autistic individual, it makes it easier to help almost everyone else because they have so many unique issues. And so I think by understanding autism, it might just give you insight in terms of helping people with some other conditions that may overlap.